Assalamu alaikum. Today we discuss humerus. This is humerus of left side. This is head, which is smooth, rounded, directed medially, backwards and upwards. This is bicipital groove, which lies anteriorly, upper end of the humerus. This is olecranon fossa, which lies posteriorly and lower end of the humerus. And this is medial epicondyle, which is directed medial. Now the parts of this bone, as it is a typical long bone, it has two end and on shaft, upper end, shaft and lower end. The upper end has the head to tubercle, greater tubercle and lesser tubercle, and intertubercular group or bicipital group, two neck, anatomical neck, this is anatomical neck, and this is surgical neck. Now the shaft, as it is typical long bone, it has three border and three surface. Here it is anterior border, here it is medial border, it is lateral border, and three surface: medial surface, lateral surface and posterior surface. Now lower end, the lower end has two condyle, medial epicondyle, lateral epicondyle, and this is trochlea and this is capitula, and posteriorly this is olecranon fossa, and anteriorly two group, radial group and coronoid group. Trochlea articulate with radius, head of the radius, and capitulum articulate with ulna. Now the attachment of this bone, the upper end has greater tubercle, lesser tubercle. The greater tubercle attached supraspinatus, infraspinatus, teres minor, supraspinatus, infraspinatus and teres minor. And lesser tubercle attached subscapularis muscle. And intertubercular group has medial lip and lateral lip. And floor, the floor attached latissimus dorsi, the floor attached latissimus dorsi, the medial lip, teres major, lateral lip, pectoralis major muscle attached. And the content of the bicipital group: tendon of the long head of the biceps brachii and ascending branch of anterior circumflex humeral artery. Tendon of the long head of the biceps brachii and ascending branch of anterior circumflex humeral artery. Now shaft, the medial surface, here coracobrachialis muscle attached, lateral surface, here deltoid tuberosity, here deltoid muscle attached, and posterior surface, here a group, radial group. The content of the radial group: radial nerve and arteria profunda brachii. Above this group, here lateral head of the triceps brachii muscle attached, and below this group, medial head of the triceps brachii muscle attached. And lower end, here the brachialis muscle attached. Here brachialis muscle attached. Now the medial epicondyle, the common flexor tendon attached, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis. The lateral condyle attached common extensor tendon, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. Now the capitulum articulates with ulna and trochlea articulates with radius. Nerve related to humerus. Here surgical neck, related axillary nerve, radial group, radial nerve, and medial epicondyle posteriorly ulnar nerve. Injury to axillary nerve, paralysis of deltoid muscle. The patient cannot abduct shoulder joint.